clinical podcast series brought to you by the American Academy of Optometry's Foundation. Today's topic is brought to you by the Binocular Vision in Pediatrics Care Channel. Relationship among clinical factors and patient-reported outcome measures in adults with convergence inefficiency. I'd like to thank our host, Dr. April Jasper, our topical editor, Dr. Plaumann, and our topical expert, Dr. Allegra Burgher. And now it's my pleasure to begin today's podcast.
Hi everyone, I'm April Jasper, and I'm speaking today with Allegra Burgher. Allegra completed her OD training at the Michigan College of Optometry, followed by a residency in pediatrics and vision therapy at the Southern California College of Optometry, where she currently teaches. She is also a fellow of the American Academy of Optometry. Today she will be discussing the September 2022 Optometry and Vision Science paper entitled Relationships Among Clinical Factors and Patient-Reported Outcome Measures in Adults with Convergence Insufficiency by Lorenzana et al. Allegra, thanks so much for being here with me.
Thanks for having me here.
It's so fun to actually be able to do this where we can see each other in person. So I love that we had the chance to get together during the meeting this year.
Yeah, in San Diego. That's
exactly.
Awesome.
I know, it's been beautiful weather. So let's get back to the study. Tell everybody, what was the purpose of this study?
Yeah, so this is a study that has come from PDIG, and it was just published, and it was a prospective, multi-center observational study looking at the relationship between symptoms and patient-reported outcome measures in patients who have convergence insufficiency.
Okay, so which clinical factors and outcome measures were the authors interested in? And then I guess we should follow that up as how did they look for relationships between them?
Yes, so what they did is they had lots of adults coming in who had convergence insufficiency, and they were determined to be symptomatic and they needed treatment. The doctors that they saw had full range to do whatever they wanted to help these patients. So some patients received prism in their lenses, other patients did different types of vision therapy, but that wasn't the goal of the study. It was really to find out what happens to their symptoms and does it relate with any of these other questionnaires that are used. So they used the CISS, they used the adult strabismus diplopia questionnaire, and they also used the 4 adult strabismus 20 quality of life domains. So they looked at 4 general domains, and they were looking to see if any of these symptoms correlated with each other.
And I bet they were very specific and strict about how they did this.
Yes, and what's important to remember about this study is it was not a treatment intervention look at CISS or at CI. It was really all about the symptoms and how they related with each other.
Wow.
Mm-hmm.
So what were the correlations that the authors found? Was greater exophoria or worse NPC associated with worse outcome measures?
Well, interestingly, there were no significant relationships between the pure clinical measures like your exophoria, your base out ranges, or your NPC, and any of the outcome measures. The only strong correlation was found between the CISS and the adult strabismus questionnaire reading function domain, so a very specific area. The correlation was between baseline measures and for both surveys. So the authors also explored what happened to these measures after these patients got their respective treatments. And the CISS and the reading function correlation existed quickly in the patients who had the PRISM treatment. And by the end of the vision therapy treatment, those patients also had that correlation as well.
So you know what I'm going to ask you next, because that's what we always do. What are the key findings from this work that we can apply to clinical care?
I think the big thing to remember from this study is that the clinical measures usually are not a one-to-one relationship with the patient symptoms, but we do see that patient symptoms do impact other areas of their lives. So their reading function, the ability for them to do their job. And when we're treating CI, we're really looking at treating symptoms, not necessarily looking for just that change in clinical measure. So we need to be asking our patients how this is impacting their lives.
Wow, so good. Thank you, Allegra.
Thanks.
And a special thanks to Cooper Vision for their educational grant to make it all happen.